Crossminer of the Year awards. And we started with this a few years ago to showcase the projects that people are doing, because there, as we have been seeing here all day, really different types of projects, very inspiring, and it's great for people to be able to show this to their peers. And we have received quite a number of really interesting cases, and they were all quite different, had very interesting aspects. But actually one of the submissions stood really out to us when we read and reviewed the Crossminer of the Year submissions this year. And so what we create for the Crossminer of the Year is the trophy. You see a picture up here. You already see it here hidden in the back. And it's a really unique piece of art. That's a unique creation cut out of a single piece of log, signifying the log data that we are analyzing. And there's a little bit of iron, some ore indicating like the gold that we are mining from it. So yeah, I'm very happy to present this trophy to David Balta from the University Hospital Lucus Augusti. We shortened it HULA because it was too long to put on here. Please come to the stage to receive the award. We also have some flowers for you, and just a few words why we chose David's submission. So it is a very compelling case. It's from the healthcare domain. It's a very relevant area, and also he very successfully showed and was able to, and then also showed how he did it to deal with the complexity that you face in healthcare processes. Right? Some of you may have seen that from other healthcare examples in the past. That it's just patients are going all kinds of ways, and you have to deal with that. And that he got really good results out of the analysis after being able to deal with the complexity. And he was really very well also able to describe those results. So we asked him to prepare a short summary of his analysis, and he will show a brief summary to you right now. So I'll take this, put it to the side.
Thank you very much, Anna. Thank you very much.
You can...
It's a really big honor to be here and to be beside you and to receive this award, because I've been working from, I think, 2 years now on this project, working with process mining. I'm a data analyst in a hospital. I like to work with data analytics and data mining. But when I took the MOOC with Professor Will, I really realized that process mining in the healthcare was something that can make a really big difference in our organizations. So let me explain you a little bit about our organization. We are a mid-sized hospital, a 900-bed public hospital. We are in northwest. We are in northwest of Spain. It's a region about 300,000 inhabitants, and we have 2,000 healthcare professionals. Even if it's not a very big hospital, we handle around 800,000 consultations a year and 19,000 surgeries a year. So it's quite a big deal to organize that. And in terms of activities, really huge. So I want to speak a little bit about public healthcare objective, because it's in Spain, as in other countries of the European Union, we have a public healthcare. And our objective is to give the best possible care with a limited budget. We are in around 41% of investment of the GDP, of Spanish GDP. So 41% of the richness that we create is going to the healthcare. It's in the average of the European Union. Netherlands is something like that, and France is around 50%. But we have a big problem because people is living longer, and treatments are becoming expensive. Cancer treatments are becoming more and more expensive. So we have a big problem with the money. And it's a really difficult balance to make. To have a high citizen overall satisfaction. In Spain, we are quite good because we are from 10, we are in 7 points of satisfaction, so it's quite good. But people is complaining always about long waiting time for a lot of activities and a lot of tests. And we have a lot of complaining about that. But it's not only a question of complaining and that's all. We will see later that it have a really huge impact in the system. When you ask a professional of the our healthcare system, what do they think about the system? They will think that it's quite a good system with highly trained professionals. And they give a very good care to the patients. And they will always tell you that it's a really big organization. Our hospital is one of the 20 hospitals of the region, with a 3 million people region. And they think that it's a very, very big organization, and it's not fast moving, and it's difficult to communicate between doctors. So it's difficult to move in this organization. And I like very much this picture because you can see that it's real that the patient is in the center of the process. But in fact, the doctor is only looking at the patient. He's looking at one part of the patient, but he's not able to communicate with other doctors because he's able to communicate with the doctor at the left and the right, but he don't see the whole of the path of the patient. He only see one part of the patient, and you see that it's difficult to see the whole path, and it's difficult for them to communicate with other doctors. And this is quite important because when you are treating a patient, you are not treating one part of the patient, you are treating the whole patient, and you have to be able to communicate with other patients and to know what is the complete path of this patient. So when you ask a patient what is their point of view about the system, healthcare system, I remember that it's public, so it's quite important for the politicians to have a good system. They think that the system is quite good and the professionals are very well trained, that they are very, very good, but they think that they spend too much time between, they wait too much time to be attended by a professional, to having lab tests, to be echography. They're waiting too much time. And they think that it's a question of money. They think maybe if the system hires more doctors, it can be, or more nurses, it can be better. In fact, I believe that it's not only the problem, it's more a question of organization. So we have a very big problem with the money, because treatments are increasingly expensive. You can't reduce cost without limiting treatments. For example, in our hospital, we have an hemophilic patient who is costing us, for the pharmacy, 3 million euro per year. And you have nothing to do with it. You have to pay the treatment, and it's a big problem. And you have to reduce the delays of treatment to an optimum, not just because it's a problem for the politics. It's always a problem of money too. So, of course, you can think of a lot of possible solutions, research and development of new treatments. You can talk to wearables and big data to be able to control patients at their homes and avoid them to come to a hospital. You can talk about genomics and do personalized medicine, or you can talk even prevention plans, but nobody cares about that. So we have the same problem. It's very long, and it's long-term and expensive, and it's very difficult to put in place. So for me, the immediate and cost-effective solution for healthcare is, of course, process mining, because I'm a big fan of process mining, and I think you will understand why. I think that it's in healthcare, it's a really game changer to use process mining. So as in other industries, you can use process mining to improve process, identify patterns, detect exceptions. But what I like the most is the ability to identify networks, because it's very important when the doctors talk to each other to be able to have a whole view of the patient and to be able to make a treatment without harming the patient more. For example, if you have a patient with a cancer in a kidney, it's quite possible that the oncologist make his treatment without talking with a specialist of the kidney. So the patient has 2 kidneys, of course, and he has one with cancer, and the treatment may harm the other kidney. So if they don't talk to each other, you may have a patient with non-cancer in his kidney, and the other one who's really destroyed by the treatment. So they must talk. And yeah, I think that process mining is the key to improve the processes in healthcare, but we have the problem that we have a really spaghetti process. We have huge complexity of the traces. Data volume is incredibly high, and we have a lot of data sources. I work with my projects. I used to work with Oracle, SQL, Informix, and you have to cross a lot of data sources. And we have long time logs. We have patients from 25 years old, and we have it inside our databases. So this is 1 month of radiology log. As you can see, it's really impossible to treat. That's my computer when trying to treat this log. It's really becoming mad. So we have more problems because it's you don't really find previous design or standardization. This is a schema from urgencies or emergencies. It's coming from your website, from Fluxicon website. It's really difficult to find something like this in healthcare. The schemas are not. You can't find them. So every patient is unique. They have a lot of different diseases. So if you search the log, it's really difficult to find what are you looking for. So to work with process mining in healthcare, you have to reduce the scope. You have to search in a problematic department like radiology, cardiology, or emergencies, for example. You have to study a group of patients. So in our system, there is something called fast pathways. It's like a priority lane for the patients. Patients can go faster when you know that they have cancer, not only mouth cancer but other cancer. When you know that they have cancer, they can go faster in blood tests, all kind of tests, and they go faster into the treatment. So on the IT side, we were looking for the diagnosis interval because we wanted to know when the patient is asking for an appointment with a doctor, so he's beginning to feel sick or have problems, and his referral to ORL department. After that, the oncologic treatment is coming, but we don't really care about that part because we know that it's going fast. And so I will explain why we don't care about the oncologic treatment. It makes a lot of noise into our data because you have a lot of treatments, you have a lot of controls, you have a lot of consultations, and you know that the cancer is already diagnosed. So we don't care about that part of the past. So the key point of that is the early diagnosis, because 80% of the patients, when you find the cancer fast, they are surviving. But if you are late in both of treatment and detecting, they have 1 or 2 years the survival. So it's really a bad disease. So we want to diagnose fast, and we want to treat the patient fast. So the best case is when the primary care detection is so the primary care doctor is detecting the disease and is referring to ORL directly, and later he's going to surgery and sometimes oncologic treatment with radiology or other treatment. So this is the best case possible. So we found that patients that was going on this path, they down this path on 26 days. So it's quite good. We took 21 patients. We selected 21 patients on our databases. Some patients are coming from 1993, so we have quite a long logs. But we selected only 21 to see better. This is the full log. And it's very difficult to understand something here, you can see. So we worked on simplify the process map. We don't want the traces after diagnosis because it's a lot of logs, and you know that it's being treated, so there's nothing to change. We want to delete traces from other diseases like urology or traumatology, things like that. It's nothing to do about mouth cancer. And we needed the doctor's expertise to know what can be related or don't. So what we found is that we did have a really big bottleneck in radiology. Because it's really normal because radiology is a central department. 40% of the hospital activity is going through radiology, and you see in the red circle, you see that all the paths are going through radiology in one moment or another. And they have around 400,000 tests a year, so it's normal that it's a very busy department. But they have very long delays, up to 10 months. So we have a big problem with radiology. We found out a lot of loops. So you see the loop in radiology, in RAD. 12 patients did this loop 4 times with a mean waiting time of 21 weeks. So it's a lot of time. So they have to repeat tests to be more specific, I guess, but they are waiting too long. So we are wasting a lot of time here. And so half of the patients were repeating tests in radiology. And we found also that out of radiology, we found inefficiency because for the radiologists, it wasn't possible to refer directly to oncologist the patient. So this is an IT problem because it's our healthcare system, healthcare recording system that doesn't allow to refer that patient. So it's only something to improve in our process, but it's a question of informatics, of IT. So the patient must return back to the specialist to be referred later to oncologist. So another great problem that we found is that when the general practitioner, so the first contact of the patient, in the system, when the general practitioner referred to a specialist, it depends on who is on where is referring the patient. If it's going to ORL, it's always correct. He can take the fast path. But if he's going to digestive, endocrinology, or pneumologist, he's taking, instead of 26 days, he's taking 1 or 2 years. So we didn't know that, and we found out that the fast path was only available from the otorhinolaryngologist, not from the other specialists. So, and between the specialists, we have the same problem. The system doesn't allow to refer directly to the oncologist. So we see, for example, in this case, the pneumologist for the otorhino is taking 33 months. So we are wasting a lot of time here. So in summary, we found with process mining, we found that fast paths that are intended to make the patient go faster in between the system, into the system, they are not working well. And we found, obviously, radiology bottlenecks. The people in radiology already knows it, but they must have the numbers to show to the stakeholders to see what is the real problem. And we found also that it's real important that to have an early diagnosis, because if it's found early by the primary care doctor, the things are going really, really fast. So next steps are giving specific training to primary care doctors, to have private dentists in the system to show what they must look for in the patient, because it's a real simple control in the mouth when the patients are going to the dentist, and really they can do a very good work if they know what they're looking for. And we also have appointments to optimize radiology, because it's a really big problem, and we have to make fast path analysis to change a lot of things. So our expectation only for this cancer is to change the survival from 1-2 years to 20 years. So okay, I think it's pretty impressive. And the cost, we can reduce the cost also, because only in pharmacy we are spending from a patient that is going bad, so in an advanced phase of a cancer, it's costing around 20,000 euros, instead of 3,000 euros per patient when you are finding this cancer fast. And we have around, only in our hospitals, 150 patients with this cancer a year, and it's only one hospital, so and one cancer. Imagine what we can do if we take this whole idea to other diseases. So, of course, I've been very fast. It's really a difficult topic, and you will find this article in the website of Fluxicon in the next 2 weeks, something like that. And I've shown you a little bit of the question, but if you need more details, you can write me or find more details on the website. Thank you very much.